Post-traumatic stress disorder was once primarily recognized in soldiers returning from war, historically referred to as shell shock or battle fatigue. This condition, however, is not just confined to the battlefield. Today, it's understood to affect individuals from all walks of life who have experienced various forms of trauma. From ancient warriors to modern day survivors, the battle against PTSD has been a long march through history. But don't worry, in today's episode, we're not just marching in place, we're marching forward, learning how to disarm the past, one memory at a time. PTSD, or post traumatic stress disorder, functions similarly to a security system that's permanently set to the highest sensitivity, where even the slightest stimulus can trigger a full scale alert. This hypervigilance is a direct result of past trauma, causing the brain to misinterpret everyday stimuli as potential threats. The symptoms of this disorder encompass a wide range, but they primarily include intense emotional and physical reactions such as panic attacks, shaking, and heart palpitations to seemingly innocuous triggers. Individuals with PTSD often experience intrusive memories that replay trauma like a looped video that they cannot pause or stop. These vivid recollections can come unexpectedly, triggered by a smell, a sound, or even a random thought that slightly resembles or reminds them of the trauma. Additionally, there's a profound and persistent effort to avoid anything that might remind the person of the traumatic event. This might mean avoiding certain places, shying away from particular activities, or even isolating themselves from relationships that bring memories to the forefront. By exploring the neurological underpinning, we can see that PTSD essentially creates a feedback loop in the brain. This loop perpetuates a state of constant vigilance and avoidance. Neural pathways involved in fear and threat detection, particularly those connecting the amygdala, which processes threat, the hippocampus, which assists in encoding memories, and the prefrontal cortex, which regulates responses and rational thought, become overly sensitized. In PTSD, the amygdala is quick to signal a threat, while the prefrontal cortex, which typically helps to assess the actual level of danger, may not function optimally to moderate this response. This heightened state of alert causes the brain's alarm system to be tripped, even by minimal triggers, much like a circuit that's been wired to buzz loudly at the slightest touch. This analogy not only helps us understand the biological and psychological basis of PTSD, but also underscores the intensity and the chronic nature of the condition, making it clear why managing and treating this disorder is both crucial and challenging. When we encounter a situation, our five senses gather data and send it to the corresponding areas of the brain for initial processing. For example, visual data is sent along the optic nerve to the occipital lobe, where it is interpreted very quickly within the tenth of a second. How this data is categorized depends on previous similar experiences and may be influenced by cognitive distortions, which can skew interpretation and emotional responses. As all sensory data are processed simultaneously, the brain, using past experiences stored in the hippocampus as a reference, interprets these inputs as a threat. It triggers a series of responses. So, first, what happens is the sensory cortex processes detailed sensory information and sends it to the amygdala, which assesses the emotional significance of the stimuli. Then the amygdala, with input from the hippocampus, which provides contextual memory details, determines if the current situation is a threat, potentially leading to an exaggerated fear response typical in PTSD. Then the hypothalamus acts like a command center, signaling the adrenal glands to release stress hormones such as cortisol and adrenaline, shifting the body into a sympathetic state, prepared for fight, flight, or freeze. The locus coeruleus produces norepinephrine to increase arousal and alertness, enhancing memory formation related to the emotional event and contributing to anxiety. The periaqueductal gray coordinates behavior responses to perceived threats, including defensive actions. And finally, the insula, which processes and is active during bodily perceptions of threats or traumatic recalls, affecting how intensely these sensations are felt. As these systems activate, the body physically responds and new memories are formed in the hippocampus, linked with the emotional and sensory context provided by the amygdala. This process explains why experiences are subjective and can vary greatly from person to person. Factors like epigenetics can also influence individuals' sensitivity to stress and predisposition to PTSD, explaining why some might be traumatized by an event while others are not. This neural and physiological framework helps us understand the underpinnings of PTSD and why experiences and responses to similar events can differ so widely among individuals. Glucocorticoids, particularly cortisol, are a type of steroid hormone produced in the adrenal cortex under the regulation of the hypothalamic pituitary adrenal axis. Here's how they influence the brain and behavior, particularly in relation to the amygdala. When a person receives a threat, the hypothalamus releases corticotropin releasing hormone, which prompts the pituitary gland to secrete adrenocorticotropic hormone. This stimulates the adrenal glands to produce and release glucocorticoids like cortisol into the bloodstream. Cortisol crosses the blood-brain barrier and affects various brain regions, including the amygdala. By binding to its receptors in the amygdala, cortisol can enhance the amygdala's sensitivity to incoming stimuli. This heightened sensitivity can make the amygdala more reactive to potential threats, leading to increased fear and anxiety responses. This mechanism can explain why individuals with PTSD may experience false alarms, where the amygdala triggers an intense emotional response even to non-threatening situations. The chronic elevation of glucocorticoids due to repeated stress or trauma can lead to a state where the amygdala is primed to react, interpreting even minor stimuli as threats. This results in the hypervigilance and anxiety typical in PTSD, where individuals are constantly on edge anticipating danger. Over time, the presence of elevated glucocorticoids can lead to other changes in the brain's function and structure, including the hippocampus, which can impair its role in contextually moderating the amygdala's responses. This impairment can further exacerbate the cycle of hypervigilance and overreaction, making it difficult for individuals to distinguish between safe and threatening environments. This altered response pattern can severely impact social situations or social interactions. Individuals with PTSD may misinterpret benign intentions as hostile, making it challenging to form and maintain personal relationships and often leading to social withdrawal or conflict. Understanding the role of glucocorticoids in modulating amygdala activity helps in developing targeted treatments for PTSD, such as medications that regulate cortisol levels or therapeutic strategies aimed at breaking this feedback loop and reducing the amygdala's hypersensitivity. To recalibrate PTSD's alarm system, a combination of therapeutic tools is strategically utilized to manage symptoms and improve quality of life. EMDR, or eye movement desensitization and reprocessing, is a highly interactive psychological therapy technique specifically designed to diminish the distress associated with traumatic memory. During the therapy, the patient is asked to recall distressing images while generating one type of bilateral sensory input, such as side-to-side eye movements or hand tapping. This process is believed to work by the brain's inherent ability to move towards mental health. EMDR therapy facilitates this process by activating the neurological mechanisms involved in the processing of traumatic memory. The eye movements are thought to mimic the period of sleep referred to as rapid eye movement, or REM sleep, which contributes to the processing of emotions and memories. This can lead to a reduction in the vividness and emotion associated with the trauma memories, effectively decreasing their impact and allowing the individual to to develop more adaptive coping mechanisms. CBT, or cognitive behavioral therapy, is a form of psychotherapy that involves identifying and challenging negative thought patterns and behaviors and replacing them with healthier, more realistic ones. In the context of PTSD, CBT focuses on reframing the distorted perceptions of threats that contribute to the overactive alarm system of the brain. By confronting these inaccurate beliefs and slowly exposing the patient to the trauma-related memory and the stimuli in a controlled, safe environment, CBT helps reduce the fear and avoidance behaviors characteristic of PTSD. Over time, this technique helps patients recognize and adjust their thoughts about the traumatic event, decreasing the likelihood of alarm reactions and helping them react more proportionately to their environment. Pharmacological interventions can play a critical role in managing PTSD, particularly when symptoms are severe. Medications commonly used include antidepressants like SSRIs or selective serotonin reuptake inhibitors, or SNRIs, serotonin norepinephrine reuptake inhibitors, which can help alleviate both the depressive and anxiety symptoms associated with PTSD. In addition, medications might be prescribed to target specific symptoms such as nightmares and insomnia, or severe acute stress reactions. These drugs may help lower the brain's overall sensitivity to stress, reducing the intensity of the emotional responses and helping stabilize mood swings. Often, a combination of these therapies provide the best results. Integrating EMDR to process and desensitize traumatic memories alongside CBT to address negative thought patterns and appropriate medications to manage physiological symptoms offers a comprehensive approach to treat PTSD. This multi-modal approach aims to help individuals regain a sense of control over their lives, enhance their ability to cope with daily stressors, and significantly reduce the symptoms of PTSD. Let's consider how we can apply these therapeutic tools in practical everyday situations. For instance, imagine a loud noise, like a car backfiring. It's the 4th of July and the fireworks are going off. That triggers a panic response due to its resemblance to gunfire, a common PTSD trigger for veterans. In such moments, grounding techniques can be incredibly effective. These techniques involve focusing on the physical environment and one's own body to anchor the mind to the present. A person might count items of a specific color around them, focus on sensation of their feet touching the ground, or practice controlled breathing. These actions help recalibrate the brain's perception of immediate danger, reminding it that the perceived threat is actually a harmless sound from everyday life, not a threat to survival. Similarly, consider a scenario where an individual with PTSD is at a crowded event that begins to trigger memories of a traumatic incident involving crowds. Using structured problem-solving skills from cognitive behavioral therapy, the individual can manage their response. They might start by identifying what aspect of the situation feels threatening, then challenge these thoughts by checking the reality against them. For example, recognizing that being in a crowd is not inherently dangerous and recalling past times they have been safe in similar situations. Next, they could develop a plan to reduce comfort, such as locating exits, using mindfulness techniques, or setting time limits for their stay. Implementing these techniques consistently whenever triggers arise trains the brain over time to respond differently. It's about rewriting the mental script from one of anticipated danger to one of managed, rational assessment of reality. Each successful application of these techniques is a step towards disarming the faulty alarms of PTSD, gradually paving the way for a return to a more peaceful, enjoyable life. And just like that, by applying these practical techniques, individuals with PTSD can begin to dial back the alarms set off by their past experiences. Whether it's a sudden noise or a crowded room, grounding techniques and structured problem solving can help steady the ship. Each successful use of these strategies not only lessens the immediate fear, but also strengthens the journey back to a sense of normalcy. With each step forward, They aren't just revisiting old battlegrounds, they're charting a new course towards peace. Remember, it's not about silencing the past completely, it's about turning down the volume so life can play a sweeter tune.